Hello, this is Dr. Kesh Clifford from Kenya, Jaramogi Oginga Odinga University of Science and Technology. We are working on leveraging on AI to improve maternal outcomes on the Lake Victoria Basin. I am working together with Silas Okumu, who is our data specialist and AI engineer, working together with a nurse and midwife, Esther Kitui, a sonographer, Edwin Munganyi, and Effie Agero, who is a public health officer and specialist. So our proposal targets the large gap in obstetric diagnostic capacity in the rural and underserved regions in Kenya, especially the Lake Victoria region. We are focusing on the missed and late detected pregnancy complications such as malpresentation, placenta previa, fetal distress, things that can be picked in good time and change the nature of the intervention that is taken so as to prevent mortalities and morbidities among our mothers and babies. We look to leverage on machine learning and federated learning in this manner that we shall be able to do guided image acquisition. That means anybody within the healthcare space is able to take data, or rather is able to perform the ultrasound imaging for our pregnant mothers and assess the fetal status and the maternal status. We will rely heavily on the automated interpretation, that is computer vision, that is machine learning enabled. Federated learning, on the other hand, will enable for continuous local adaptation of our model, as we'll be able to share our model updates with people in other regions, and it will therefore improve our outcomes and our results as time goes by. Machine learning embedded ultrasounds will also enable our triage as well as our referral processes to be more real-time. As soon as we pick an issue, we can make a referral, we can get in touch with a doctor or a consultant who is from a distance. How do we then ensure ethical inclusivity and privacy preservation? First and foremost, we ensure that we will take proper consent from our patients with whom we shall be using their data. So we'll get informed consent and adherence to our local governance on Data Protection Act, as well as the WHO, guidelines on healthcare AI usage. There is privacy by design, of course. When we are doing federated learning, then we are not going to share any raw images. There are going to be annotation, there is going to be anonymization and even pseudonymization of the images that we share as we use this. We shall mitigate bias and ensure local relevance by continual updating of our model on the federated learning platforms and continually train our model as we use the data from the local people that we are going to be constantly using and constantly examining using our tool that we shall develop. We shall ensure inclusivity and accessibility of this by including our community health volunteers, the nurses, and the midwives to ensure uptake of this idea. We shall be able to maintain logs and monitoring dashboards and regular stakeholder and community engagements to explain the limitations of this process, as we also explain to them why this is an important concept to have across. In terms of what we shall need to implement this prototype, of course, we need the personnel. That would be the medical consultants or obstetrician for clinical design and validation of what we are working on. We have a data scientist on board. We have a sonographer on board who is trained and will help with annotation standards and even training of people on how to handle the sonography machines. Our public health specialist, on the other hand, will be helping us with stakeholder engagement, monitoring and evaluation, and even just getting in touch with the people that are around. The nature of the hardware that we need would be the AI-capable ultrasound devices, maybe a number that can be moved from one place to another. We shall need smartphones or even rugged tablets for a better user interface and to help with the data collection. We shall need a local server for the same. We will rely on software and systems that are usable in a machine learning and model development and environment, such as the TensorFlow, federated or SciSift, and even custom federated learning orchestration. We will work towards developing a mobile app, which therefore means our system is usable by people around. Our data, we hope to get curated and annotated ultrasound images, both local and global mixes, with standard labels for the target conditions that we are looking at. Security and legal considerations, we are hoping to adhere to this based on our Data Protection Act within the country. Additionally, we shall train and do proper stakeholder engagement within the community and healthcare workers within the community. Thank you very much. We hope that this shall leverage on AI to improve maternal outcomes.